Laser trabeculoplasty has been used for the treatment of open-angle glaucoma for over 30 years. But more recently, argon laser trabeculoplasty, which was the original laser used, was supplanted by the introduction of the selective laser. And this was developed by Dr. Mark Latina in Boston. And he really keyed in on the pivotal concept that pigment was very important in absorption of laser energy. And we know that with the argon laser, there's a lot of heat disruptive injury, coagulative injury in the angle of the eye. So taking that concept of the pigment being crucial in the absorption of the energy, he honed in on a wavelength, which we now know as the selective laser wavelength, which is a frequency doubled neodymium YAG laser, and was able to show that this offered a comparable effect in lowering intraocular pressure without causing a coagulative injury as argon laser trabeculoplasty does. He showed that in vitro. Others like Noecker and Kramer showed that in cadaver models, and then finally clinically that the selective laser lowers intraocular pressure well. And furthermore, Dr. Damji in Canada did a comparative trial comparing argon laser trabeculoplasty versus selective laser trabeculoplasty in eyes that failed medical therapy, and he showed that both were effective in lowering intraocular pressure, and they seem to be equivalent. Now, there have been some further studies looking at the selective laser even as a standalone therapy, as an initial therapy for the treatment of open-angle glaucoma. Dr. Choka Malamed in Israel did one of the original pilot series showing that there is a marked pressure reduction using laser only, the selective laser trabeculoplasty only, to lower intraocular pressure. So that was an exciting step forward as an alternative to medical therapy. Since that time, Dr. Nagar in the UK, and also a Canadian trial, as well as a United States trial that I helped to head up, compared selective laser trabeculoplasty with medication and showed that it was equally effective to our best single medications in lowering intraocular pressure. Well, glaucoma is an irreversible blindness, and we know that we can prevent it by lowering intraocular pressure. The trick is, how do we lower intraocular pressure for patients with glaucoma? Glaucoma is a disease that early on doesn't have any symptoms, and if the patient goes on to develop visual loss, even if you lower the pressure at that point, it's irreversible. So the idea here, the key element, is to try to diagnose patients early and treat them effectively by lowering their intraocular pressure. The drawbacks to therapy with medications for the treatment of glaucoma is that people have to take it every day. It costs money. It has to be renewed. People have to tolerate it. There are side effects that may not be tolerable. So there's a real drawback to using medications, as we found out in the treatment of glaucoma. So right now, just diagnosing glaucoma, over half the people that have glaucoma in our country have yet to be diagnosed. We're not reaching them out in the community. In underserved areas are probably even higher percentage of patients that have yet to be diagnosed. And then we have to have some type of effective therapy, and compliance or adherence with medical therapy is a huge obstacle for many of our patients, especially people with limited incomes and access to medical care. Therefore, we have tried other approaches, and one that we're currently trying in Philadelphia through the help of the Centers for Disease Control in Atlanta is to have mobile units to go out, identify patients in high-risk areas, and these are patients that are often minorities, people who are elderly, and we found that many of these patients have never seen an eye doctor or seen an eye doctor for the past several years. And once we have access to these patients, we can identify them, we can offer them therapy. Now, the therapy for their open-angle glaucoma could be either laser trabeculoplasty with the SLT or medication. We have an educational seminar even before the screening process, which takes all of 10 to 15 minutes, educating them about the disease and the help that they can receive by lowering their intraocular pressure by either laser trabeculoplasty or with medication. And we found that with that educational program, the show rate for their screenings for glaucoma are over 100%. In other words, all these people come, but they bring their friends also from the senior centers where these programs often take place. So if we can get to these patients even where they live in the communities, we can kind of treat them. Well, when you're comparing therapies for glaucoma, the things that you have to compare are efficacy, which means lowering intraocular pressure, safety, which is the side effect profile, compliance, the ability to continue the therapy, and then finally the cost. So when you compare all those, starting with efficacy, we have studies showing that SLT compared to prostaglandins or beta blockers seem to be just as effective in lowering intraocular pressure going out to at least 1 year. So they're comparable to our best monotherapy with our current drugs. Secondly, safety. Well, with medicines, we know that there are all sorts of side effects depending on the drug that you choose. Even topical drugs can have systemic manifestations. So beta blockers, for example, can cause people to have bronchospasm and exacerbate their asthma. They can also have problems with their heart and have bradycardia and have dizzy spells and maybe even fall down and break their hip. Other medications have side effects on the eye, causing red eye, irritation in the eye, blurred vision. So we all are familiar with the ocular side effects and the potential systemic side effects of even ocular medications used for glaucoma. What are the side effects that you can have with a laser trabeculoplasty? Well, the most common is that there may be a transient pressure elevation. That's usually short term, doesn't last long. Some people have inflammation, some people can have blurred vision, but by and large, the vast majority of patients do very well and don't have any particular side effect from the procedure. What about compliance? Well, with compliance, our best guess is that maybe half our patients with medical therapy are compliant enough on a regular basis to be consistent in their therapy to keep the disease under control. On the other hand, with selective laser trabeculoplasty, you do the treatment, that's 100% compliance. So there is no issue of compliance. Finally, with cost issues, there have been cost analyses done in Australia, Canada, and even in the United States, looking at SLT as a first-line option or as an adjunctive therapy compared to medications. And the joint opinion from the United States and abroad are that selective laser trabeculoplasty can be a very viable economic choice, which is so important in today's economy and healthcare issues that are going on in the United States and elsewhere. So SLT seems to be a viable option from the cost standpoint. So whether it's efficacy, whether it's side effect profile, compliance, and finally cost, SLT seems to be a very reasonable choice compared to medical therapy, which has been our mainstay for the treatment of open-angle glaucoma.